Hello everyone. So for this presentation, I'm going to share with you the practical implementation of data capturing using the Rescue platform. The way that I'm going to arrange this talk is that I'm going to first discuss all of the related topics adjacent to a case study. So I'll start my case off with Mrs. Z, a 69-year-old female with a history of hypertension who developed sudden onset of right face and arm weakness as well as aphasia upon awakening this morning. The symptoms seem to have been persistent even by the time her son came into the room, so they decided to take her to her nearest healthcare facility. Fortunately, it was Steve Biko Academic Hospital. So the patient arrives in the ED at approximately 10 a.m. The triaging officer gets notified by the arriving EMS that there's a suspected stroke. Without delay, the stroke code gets activated and the NHIS scale is quickly performed by the pressing of a couple of buttons on an app installed in the ED department. So by activating the code, a couple of buttons is pressed on an iPad found on our stroke trolley located in the front of the emergency department. So on this trolley, you will find the necessary vitals monitors, a rapid INR analyzer, a glucometer. So all of this information is going to be necessary once the data registry is going to need to be completed. So once an IV cannula is inserted, stroke bloods are taken, a rapid glucose is done, and the blood pressure is recorded. And the patient does not have any contraindications to TPA, most noticeably not on warfarin. Again, all of the buttons are pressed on the app, which then records the necessary time, which again can be later used for the stroke registry. This task is vital, so if you do not have access to an app installed on an iPad or Android device, a dedicated timekeeper is going to be necessary for this step. The patient then gets moved straight to the radiology department to receive perfusion-based neuroimaging because this patient meets the criteria for being a wake-up stroke. So now let's capture her data using Rescue. The first thing that we'll have to do is to log on using the Rescue platform. There are two options to choose from, Rescue Home and the Rescue Reports section. Rescue Reports allow you to access all of and review all of your statistics governing your stroke admissions. You can look at comparative results of the country as well as your current progress regarding admissions. You will also find out how far you are with your progression in the certification process. So once you've logged in, you'll be taken to your dashboard. Here you can view your current patients that you have enrolled as well as the expected number of strokes per year, which in this case, as you can see, has been severely underestimated. So to add the patient details, you have to click on Add Patient. So following this, you'll be presented with two options, Rescue 3.0 as well as FACE or Fever, Sugar and Swallow entry options. Now FACE entry is more applied for the nursing staff or allied health, whereas as medical doctors should use Rescue 3.0. So Rescue 3.0 is quite extensive. Therefore, I'm going to break these headings up into different sections, which I will then discuss in light of our patient that we've just admitted to the hospital. I will start with capturing the patient's admission data onto the platform. Okay, so we will start with capturing the patient admission data. Okay, so we know it's a 69-year-old female and it was a wake-up stroke. It did not happen in hospital. So let's say the stroke occurred on the 8th of May, and the date of onset of symptoms were also first noted on the 8th of May. Patient arrived to the hospital from home by private transportation. The family brought the patient in. And the patient was subsequently admitted to a high care resus bed. We know it's a female patient. The patient went to bed at 11 o'clock the previous evening. And she was brought in to us via the emergency department. The time when she was admitted to the hospital was occurred at 10 o'clock. And she was admitted under neurology. And that would capture all of the patient data information, the admission data information. So next I will look at the hospitalization data, and most of this occurs during the patient's admission workup. So next we'll look at the hospitalization data for this patient. So as we can see from this list, we have a whole list of pre-morbid comorbidities that we can choose from, and from this we know that she was hypertensive at admission. The treatment that she received was antihypertensives, and her glucose on the time of admission was 6.3. We also waited for the formal bloods, so the LDL cholesterol showed a value of 2.4. And from the blood pressure reading that we found at the time when she was given a thrombolysis was 146 over 92 diastolic. The NHI-SA score was 12, and a modified ranking scale was a calculated 3 with moderate disability. We did not perform INR testing because she was not on any vitamin K antagonists, and she was tested negative for COVID. A GCS or Glasgow Coma scale was 15, and this should conclude our hospitalization data entry point. And as we can see, this is quite an extensive and nice data that we can capture here. So in the next section, we're going to look at capturing the imaging data as well as looking at the stroke complications that happened during the hospital stay. It's just important to note that I'm going to go through a more extensive subtype of neuroimaging data, and this is only true if you do have these options available at your facility. Okay, so next we're going to look at how to complete the imaging, diagnosis and treatment section. So the imaging modality that we chose in this patient was a non-contrasted CT with CT angio as well as CT perfusion imaging, because this was a wake-up stroke. This occurred at approximately 10 minutes later since the time of arrival, so 10 past 10. There was no previous infarcts noted on the neuroimaging modalities that we looked at. And we can see there's a whole list of different pathology that we can plot in here. So for this patient, that she had an ischemic infarct, and a calculated aspect score was in the vicinity of 6. She had an occlusion over the middle cerebral artery on the left, that M1 division. And the CT perfusion deficit was noted over the medial aspect with a calculated core of approximately 15 mils. The total stroke volume was 65 mils, and then the penumbra was approximately 50 mils. So we gave her thrombolysis. So the medication that we chose to give her was alteplase. And then the total dosaging that we administered was 63 milligrams. So the bolus occurred about approximately 22 minutes past 10. So the door to needle time was 22 minutes. And there was no anticoagulation indicated for this patient, as she was not on any NOACs or warfarin at the time. The thrombolus was given inside, the bolus was given inside the neuroimaging department. And we did not perform a thrombectomy in her because we do not have those facilities available at our institute. Great, and that will conclude this section. So next I will look at post-acute care data. And this is all about what happened to the patient following that first 24 hours since the time of admission. Okay, so next I'm going to show you how to complete this post-acute care form. So she was hospitalized for more than 48 hours. She was not ventilated, and the decompressive craniotomy was not performed on her. Her carotid arteries were imaged, and CT angiography findings revealed that she had more than a 50% stenosis, and therefore, according to the North American Society Carotid Endarterectomy Trials, she was indicated to have endarterectomies done on her after the first 48 hours. She did not have any atrial fibrillation, and the cause of the stroke was large artery atherosclerosis. We administered Plexane for secondary DVD prevention, and she did not develop any complications post-stroke. A CT neuroimaging was requested on her 24 hours later once this infarct occurred, and they just revealed the core infarcted area. The penumbra didn't show any marked changes. And then we observed her fever and glucose following the time. So there was no recorded hyperglycemia or pyrexia since she got the medication. A swallow assessment is performed on all of our patients. Classically, they're kept NPO since the time of admission. Thereafter, it's performed 24 hours later. It's performed by the speech therapist or the stroke team. So we perform the GUS or the South African swallow assessment on our patients. She did receive rehabilitation. She was indicated to get that. So she got physiotherapy as well as speech therapy and occupational therapy. And that will complete this section. So let's move on to look at discharge data. So discharge data governs the disability that she had upon discharge as well as the medications that we gave her. So let's quickly see how to fill this in. So the discharge data consists out of the patient's discharge destination. So you're going to select from this list the numerous possibilities that we have. So we sent our patient to the rehabilitation unit. Which you're going to select from this drop-down list. We're also going to complete the date of the discharge. So typically this is done retrospectively. So once we have only discharged the patient, we can fill out this information. And then we're going to fill out the disability score upon this discharge. We also have to complete the secondary stroke prevention. So our patient was discharged on antihypertensives as well as the rest of the secondary stroke prevention protocol. Then we make a follow-up date at our unit. And then if the patient was recommended for a smoking cessation program, we will type it in here. So follow-up care is really not compulsory. We can see there's no red stars that we have flagged in here. So it's really a tentatively easy process. And if it's too time consuming, then we don't have to fill this section in. Okay, so let's quickly look at the possibilities that we have for follow-up care. So as we can see, we can choose our mode of contact. So there's a whole list of possibilities that we have from face-to-face contact up until virtual patient contact. And then we click choose the date. And then obviously we're going to mark down the 3-month modified ranking scale, which we can select on that list there. Once this, the whole list has been completed, we have to choose, we have to select this to say that a mark case report has been completed. And then you click on the save button and that will complete your patient's data entry point. Okay, so let's say the patient was admitted to the hospital, but you don't have that workup that is completed, or all of the data is still not done yet or recorded in the file. So you want to continue. So what can happen then is once you've completed the case, you don't have to mark this as the case being completed report button. You just click on the save button. So once you've clicked on the save, you can mark the exit button, and then you can exit the form and continue any time when you have the data available. You can continue with this afterwards. So another scenario can happen when you have missed something during this data entry process. So what's going to happen here is, as an example, is you can mark the case as being completed. So you're going to click on this button. You'll see that there's a pop-up button that states that you have completed this form. You're going to say OK, and then you're going to press save, because this is what you're going to do. So the moment you've missed something on the form, it will highlight as an error box, and then you can just go and complete this. It will be marked by an exclamation mark, as you can see here next to age, as well as arrival time to the hospital. So if those data is not completed, then you can always go back and then just quickly go re-enter these data points. Okay, so now we can see that we've completed our patients and the patient's entry part. Now we've got all of our patients that are enrolled for our registry. Now we can click on the rescue report section, and this is really the fun part, to see where we're coming from and where we're actually aimed at and going to. All the statistics that we've entered. So once we click on that report section, it will take us to the reports dashboard. Here we will present it with many options or choices. So the first option that I'm going to look at is the report section for our hospital. You can also then view your hospital timeline, as well as the subsequent Angels rewards. So this will be the rewards that you will receive at the end of your quarter. And then we can download the report sections as well. So there's a couple of formats that we can choose from, and this can be incorporated into your own statistical analysis. So once we've selected the report section for our hospital, it will take us to a nice simplified summary of what happened to us this quarter. You can see here, this is our total number of patients that we have seen. This is the swallowing assessments that we've chosen to do. So classically, we do the South African swallow assessment, and then the GUS is the second highest on our list. You can also see your median door to needle time. So this is currently, we're sitting at 15 minutes. And this is the percentage of strokes that we're currently seeing in our hospital, or the patients that have been flagged via the stroke pathway. Okay, so I just want to quickly take us one step back and just show you what the download reports section looks like. So once we've clicked on this link, it will take us to the next page where we can download these reports into some nice formats. So once you've selected that link, it will take you to this page where you can choose the format that you want to download your results in. So you can either choose from Excel, PowerPoint, or you can even download the raw data to be processed into some another form of statistical analysis software. So this is just an example of what the PowerPoint format looks like. So it will give you numerous slides with all of the data analyzed in graph format on these slides. So this can be used for future presentations, or even just for your own statistical analysis if you want to have a look at it. And this would be the Excel format that you can download. And really, there's a lot of detail in here, ranging from the individual patients, the hospital folder numbers, down up until the ages, distribution of strokes. All of the data that you've entered into Rescue 3.0 can be sorted according to this. So you can really use this for future statistical analysis and publications. And then the final data format that you can download is the raw data, which can then be incorporated directly into analysis software like Stata, etc. So this really simplifies things even a lot more. And with that, I'm going to end the session. I hope you learned something and how to enter patients into the rescue database. And that's really a simplified process. And once you get used to it, it goes really smoothly.